welcome to EPCC Talks. I am Dr. Amber Archuleta Lucero. So glad that you are here. Thank you for supporting us. Thank you for always encouraging our shows, and we are listening to you. So thank you for that. My co-host, Claudia Chacon Haley, will be back the next time, but I do have some special guests today. They're actually familiar and family to the show. They were on a couple of years ago, and they have some really important information to share with us. Let me formally introduce them. We'll get started with the show. So first of all, welcome Dr. Estela Valles, my colleague from government.
Well, fine, thank you, Dr. Archuleta. Is it okay if I call you Amber?
Of course. And welcome back, Dr. Mina Hadarian.
Oh, thank you. It's a pleasure seeing you again.
Absolutely, my honor, completely. And welcome back, Dr. Anna Jazeri.
Again, also thank you so much.
Yeah, we're happy. We're happy. A good team here. So let me start with Dr. Valles. Estela, we're talking today about RSV. We have some medical practitioners with some very detailed information about RSV for our community. But let me start with you, my friend. You and I are friends. We talk off, cameras. So tell me, where do we want to start on this? There's so much information. You have a personal story to share, as well as some of your own community members, family members, friends, and so forth. So I'm going to let you take the reins, my friend. Tell me where we're going in this conversation today.
Thank you so much, Amber, for the work you do, the important work you do, and for allowing us to bring in these professionals to help us understand the seriousness, in my estimation, of RSV, Respiratory Syncytial Virus. It comes across as a simple cold for those of us who are healthier. However, what I have found out through great cost is that the implications of having it with people in your family, whether they're elderly or they're small children or somebody who's pregnant, can be much more complicated and to the extent of almost deadly, as in my case. Darling, I shared with you that I lost my mom in April of this year.
I'm so sorry.
Thank you, my dear. And it was as a consequence of my having a cold. I caught a cold from my daughter. She'd had him for 3 to 4 weeks, and she was masking and staying in her room. And then she wasn't getting as healthy as I was hoping she would, so I started taking care of her and cooking for her and taking her food to her room and so forth, and I ended up catching the cold. It was a very simple cold. My throat felt itchy. I had a slight headache. I started to sneeze a little bit, and then I started to get tired. Because I also cared for my mother at that time, I decided to go ahead and go see a doctor to make sure it wasn't COVID, to make sure it wasn't anything else. I went and had myself tested. They tested me for the flu, they tested me for COVID, and they tested me for strep throat because of the itchy feeling in my throat. I was also producing phlegm, phlegm that did not taste like or feel like or smell like the phlegm from before. It was different. And I say that because I think it's important. Shortly thereafter, when I came home from the doctor, I told my mom, I'm negative, nothing, I'm okay. And she said, maybe you should wear a mask. And I said, I don't think I need to because it's very slight. Whatever I have is going to go away. Well, a couple of days later, she starts to get sick with a cold. We think it's a cold, except in her case, it quickly becomes a phlegm disease or a phlegm illness. And her phlegm is harder to get rid of. Dr. Hadarian was my mother's doctor. Right away, we contact her office, and they're on top of it. And Dr. Hadarian will tell you about the things that they did. Dr. Hadarian was concerned that it might be pneumonia, but we had her tested. It came out negative, so there really wasn't anything much to do. What did happen, a strange symptom, was aside of the fact that she couldn't get rid of the phlegm, is that her head fell down and she was walking around like this for several days. And then she was getting weak, and so I was having to put her in and out of bed, helping her go to the bathroom and so forth. And at one point, I was concerned about her head because she couldn't pick it up. And we did a trip to the bathroom at night, late at night, and I put her in bed. And then when I put her in bed, her head went back up. And I said, Mom, your head went back up. And then she was basically out. And I had some EMT training as a young person, and so I recognized that she was unconscious. And she was in bed and unconscious, and so we called EMT. They came and took her to the hospital. That was, I think, a Friday. And by Saturday morning, we knew that she tested positive for RSV, but it now had become pneumonia, and then shortly thereafter, she was on machines, and it had impacted her lungs and her heart. Basically, the doctor said, you have two options. One is we can leave her on the machines, or you can take her home. And I shared that information with my mom when she was finally conscious, and she said, take me home. And when I said, Mom, but if I take you home, you're going to die. And she says, take me home. I consulted with my siblings and my nephews and nieces and extended family members, and we said, Mom wants to go home, we take her home. Monday morning, I believe it was a Monday morning, we were trying to find a priest because my mother was a devout Catholic, and we were looking for her last rites. Luckily, we got one, and she died shortly thereafter.
I'm so sorry.
Thank you.
And I know repeating this is extremely difficult. I know it's, you want to get the information out there so it becomes routine, but I can feel the deepness of what you're telling us. Thank you for sharing that with us.
Thank you, Amber.
On behalf of everybody, my heart breaks for the loss of your mother.
Losing my mom, as high as the cost was and as unexpected as it was, it's not a loss. This is a purpose for it, and it's for this community to understand the seriousness and the implications of RSV.
Yes. Let me, before I go to Dr. Herdarian, because she has some medical information as well as Dr. Jazari to share with us, can you tell me a little bit about your community of friends? I think some of your community of friends also were affected by RSV. Can you talk to me a little bit about that?
Yes, and so shortly after my mom left, and we were receiving more information about people needing to get vaccinations and that sort of thing, I received my measles vaccination in the 1960s, and so I knew I had to get another set of shots, and so I went ahead and went to the medical clinic where I live, and by coincidence, I met two lovely ladies there, and one of them shared with me that she had lost her niece when she was caring for the baby, because she had RSV and she was caring for the baby. She didn't know she had RSV. And then the other colleague of hers actually almost lost her granddaughter from RSV. The child was 2.5, and the RSV did not go away easily. They combated it for almost 2.5, 3 years, from what I understand. And they were going to try to be here to share their stories, but I think that they're okay with my sharing that, because this is extremely critical. And I want to convey to the community that the common cold as we once knew it is no longer common. It's much more complicated, and that hopefully the doctors will help us to understand some of the things we can do to try to alleviate the seriousness and the potential complications of catching what we think is a simple cold, and it actually killing people we love dearly, unexpectedly, indirectly.
No, absolutely. You're right. This always has a purpose, right? Nothing is coincidental. So there is a purpose behind everything. So thank you for that. Let me turn to Dr. Mina Herdarian. First of all, thank you for your work in our community. My own mother, hi Mom, was your patient in another city. You greatly impacted her life because you listened. And thank you for that on behalf of my mother, who's 79 years old. Let me talk to you, Dr. Herdarian, about our community. Can you share with us some of the things that you're doing? What do we need to watch out for? What are some of the symptoms? What do we need to be careful for in our community? I know we're in the height of the season right now, so what can you share with us, please?
When I see patient, even if they have like a little bit of congestion, cough, or they say I'm congested or I have allergy, I immediately give them a mask, because we have a lot of elderly people in our clinic that they have a lot of comorbidity, high blood pressure, diabetes, heart disease, and they're at risk. And I ask them, please do that, because we have patients that they can be exposed and it can kill them, it can cause death. So it's important to use masks to prevent getting this virus. During pandemic, since we were using a lot of masks and keeping our distance, we didn't have much flu, we didn't have much cold, we didn't have much RSV, respiratory syncytial virus, which is similar to cold, or upper respiratory, which causes upper respiratory infection, and it can cause pneumonia, and it can, as a result of those, it can cause into asthma, and people who have heart disease or diabetes, they are more at risk, or immunodeficient, they are at more risk. As Dr. Stella Vyas said, that even if you have a little bit of cold, it's better to wear mask over it with your friends or family members. I think that's prevention is better, and also exercise is important. The American College of Society says that 150 minutes of vigorous exercise per week. And exercise improves your immunity, it decreases risk of any cancer, breast cancer, colon cancer. Eating healthy, taking your supplement. I know some people, they say, oh, supplement is not good, but I firmly believe in supplement, taking your supplement, especially vitamin D and C. Vitamin D improves your immunity during COVID. I have a list of fruits and vegetables on the door that people take picture or supplement that I encourage people to do, and I encourage people, if I exercise 2 times a day, I expect my patient to do that too. I try to be a role model for my patient. I'm not sure if you want to know about the symptoms of respiratory syncytial virus.
Please.
Is like similar to common cold, congestion, runny nose, sneezing, light fever, and cough. And it can be a little bit serious. It can become pneumonia. And as a result of that, it can cause long-term effect like asthma, and asthma, which is different type of inflammatory system of the bronchial or lung disease. And the prevention, we can do vaccine. There is 2 vaccine that is available, and but the long-term effect of the vaccine is still to be determined. It may be once a year to get a booster, but for now we don't know the long-term effect of the vaccine. And I think Dr. Jazari can elaborate on the treatment that for the children, that there is a monoclonal antibody that children, infant can get.
Okay, thank you for that. Respect to the medical profession, what you do in our community. It matters greatly. People that I know that have experiences with doctors that are lovely and that aren't so lovely. Mm-hmm. But every time that I speak with you, I can see the passion that you bring to your patients, and I'm so grateful you're here today to share with us that information. Let me pivot to Dr. Anna Jazari. So I'm always interested in these little ones in terms of RSV, other complications, treatment, and so forth. So just to redirect, we are looking at your community of patients as our little ones, our children, correct? Okay.
So, well, I'm an OBGYN, but part of what we do is as OBGYNs is help try to prevent. So the most common cause of hospitalization in the first year of life is the RSV virus. Specifically, it's one of the most common causes of something called bronchiolitis. The bronchioles are the little airways in the lungs that get inflamed, and so the babies can't breathe. If you've ever heard a baby that has bronchiolitis, you never forget that sound. It's a just watching these poor little ones trying to breathe and things like this. So what we're trying to do is prevent, and especially starting, September, October, going all the way through the winter, we try to prevent the first year of RSV, the first RSV season having an impact on our little ones. Mm-hmm. So the OBGYNs and the pediatricians are working together to try to do this. One, if you are pregnant between 32 to 36 weeks in the fall, then the OBGYNs are going to offer the vaccine. So only the Pfizer Abrysvo vaccine is approved for use during pregnancy. So that's the one that we ask people to go get. But you can go to the different pharmacies in town and get that between the 32 to 36 weeks, even if you have Medicare or if you have private insurance, either one of those. So after that, children that are under 8 months old during the RSV season, we ask that they get the monoclonal antibody, the nirsevimab. So that's an injection. It helps actually prevent the virus from attaching to the cells inside the lungs. It's not permanent. It only lasts, but it will last throughout the RSV season. And so at least the first RSV season, their first year of life. And for those that are high risk, the second season as well. So children that have
what would the second season be? First season, September through
so it's October through January, or it is like when we're asking them to get this, specifically asking them to get the monoclonal antibody. But so the season lasts. Dr. Hedarian is right. The season lasts until March, and even in Dr. Valles' mom's case, that was in April. So it can last longer. It doesn't mean, viruses, we say they usually act like this, but viruses change, they adapt, things
Tell that
like
to
this.
a virus.
Right, exactly. They don't know that it was April and we're not supposed to be there around anymore. So that's what I mean by second season. What I mean is the first year that the baby is going through the RSV season is the first season. The second year that they would be going through the RSV season would be the second season. So don't be upset. Like if you're pregnant and you didn't get an RSV vaccine or they didn't offer it to you, don't be upset with your OB. It's just that you may not have been pregnant, you may not have been the 32 to 36 weeks at the right time of year to get the vaccine. So that it's only offered half of the year. But the monoclonal antibody treatment can still be offered to your baby as they go through this first RSV season. So the babies whose moms got vaccinated don't have to have the monoclonal antibody. So a lot of moms choose to go ahead and get the vaccine themselves instead of having to give the baby a shot. The other thing that I just wanted to talk about was what it looks like when your baby has the bronchiolitis or the severe form of the RSV. Because of course babies, they have runny noses, they get sick, and things like this. So how do you tell the difference between something that is severe and something that is just a pediatrician visit maybe, or things like this? If we're running a high fever, when they are breathing, they are having to use their abdominal muscles. If you see between their ribs that it's kind of sucking in, if their color is off, anything like this, then that's an emergency and you need to take your baby to the hospital so that they can get the appropriate support for breathing and things like that. And a lot of times we're the ones that accidentally spread the virus. Moms and things like this, we don't realize that we have it because it doesn't affect us. So Estella's story, Dr. Valles' story is so common. Of you just have a little bit of a runny nose. Maybe you think it's you think it's just allergies or things like this. But as Dr. Hedarian was saying, going ahead and masking up if you're around children under 1 or the elderly or anyone over the age of 60 that has comorbidities like heart problems, breathing problems, things like this. Just be respectful of our community members. Wash your hands, and then the RSV virus also can be spread on surfaces. So, wipe down surfaces, things like this, with with your antiseptic wipes or whatever you have, and those little things don't seem like much, but it really does have an impact as far as spreading the virus and things like this.
And wash your hand.
Yes.
And usually it happens through the droplet when you cough, when you sneeze. And a lot of my patients, they come in and they say, oh, I have an allergy. It's a little bit of allergy. And then I test them for majority during COVID, and it was COVID positive or flu positive. So we did have a test for RSV, which is a small test just like COVID. And that can be tested in offices too.
Okay. A nasal swab?
Yeah, it's a nasal swab.
Yeah, yeah. Dr. Herdarian first, when, I mean, RSV is serious. When, as you say, does one, see themselves, see their family members, feel like kind of okay? How quickly can RSV turn the corner?
Well, it depends. It depends to if they're healthy. Even healthy young people, they have had issue that it caused death. I mean, I know a few people that they died from either RSV or flu. But as soon as you get some symptoms of a congestion, runny nose, cough, and you're not getting better, first of all, wear mask, wash your hand, and clean the surfaces. And then if you're not getting better after a day or two, you need to go see the doctor, because they test you and then they will put you on the right medication or help you before it gets too seriously that you get short of breath and you can't breathe and you're fatigued, tired, and that would be too late, because it can cause respiratory failure and the oxygenation goes down, and that would be like intubation, and it creates more complication for the patient.
No, we appreciate that advice, because we talking off camera, see a particular thing, feel a certain way, and just make an assumption based on that. But
And in El Paso, I see a lot of cold or flu or COVID or RSV or infection from December. Our office gets busy from December to March, because that's the time in El Paso we see a lot of people sick. And right now it's like a summer for us. Slow season.
it's coming. It may be coming.
Well, we have family come from out of town. We get together for the holidays and things like this. And so just when we're getting together over the holidays and things like that, if you have a runny nose, just mask up, and don't make it a
Big
a big fuss or anything like that, but just being caring for your loved ones.
And some of my patients are really against it. They don't want to wear it. They were during COVID, they were against masking. But some people, now they're okay. When I ask them to wear the mask, they do. It's nice.
Well, we want to follow the advice of our physicians, right? I mean, that's the goal in life. Follow the advice of your physicians.
If I may add something.
Absolutely. Tell us, please.
Going back to the vaccine, I had shared with you all that when my mom had passed, my cousin was coming in from California to help me out, and I was told that the vaccine was easily accessible. It was not. I was told it wasn't expensive. I was told that by nurses at the hospital we were at. It was not. There was misinformation, and I'm concerned about that. I'm only concerned because I still don't know. And I don't know, who really knows aside of the doctors here that are sharing information with us. But for people who aren't in those two categories, and I was told at the time that the vaccine was only for small children or pregnant women and for older folks. So those of us in between, that's a different story. I don't know, and I wish we knew, and that's part of the reason why I've asked, our friends and professionals here to come discuss this. Not only am I asking for our community, which we all care about, and we're all invested from, each one of us at this table, but to change our perspective of what used to be known as the common cold, but to also recognize that our system here locally is not prepared for something like this, because in actuality, RSV has impacted 64 million people throughout the planet, and approximately 160,000 of those deaths happen to people from the ages 5 and below, and 65 and above. 97% of RSV-related deaths in children occur in low socioeconomically status families, and RSV is often the secondary contributor to what actually was going to take them out. And so we're misreporting how they're dying because it's initiated by RSV, and it becomes more complicated with the people or the population that has been referenced by the good doctors. Yes. And so I'm seriously concerned that our community is, which was very vulnerable during COVID, as you all know, we made international news. We lost so many people, we couldn't keep up with them. We had to use 18-wheelers with refrigerated air to store their corpses because they were gone, and we weren't prepared for it. And so I'm thinking we can do better, and that we must do better. We have too many important people in our community, little people and older people and people in between, but we don't have the resources, especially with the type of budget cuts that we're experiencing at the national and state level. And those are concerns that I think hopefully our show today with our good doctors will help us to reckon with. And I'm planning on taking this to the mayor's office as well, because I think it's that important.
Yeah. Well, and you know, I always am just grateful that you come with such details and numbers and stats that even in our last show 2 years ago, you had such, you know, incredible numbers to share. And we will have some information at the end of the show to share as well, some things to consider. Let me ask you this, Estella, as we're wrapping up. The takeaway from your mom's death and from your unfortunately your friends, all of those takeaways, you're telling me that, you know, we've come here today with a very serious topic. We need to take it very seriously. What is it that, you know, any last words you'd like to share with our community? Just, I know your own experience impacts this greatly, but you're in a community college, you're around people all the time, colleagues, students, and so forth. What is it that you'd like to share with us as we close today?
I think that the pandemic has changed our viruses in ways that we're still not fully recognizing. People who do research, as our doctors do, and as ourselves, as scholars and academics, the things that I'm reading in terms of how viruses are quickly changing and evolving and becoming more vicious, I think is something that has to be put into the context of communities like ours, where the common cold is no longer common, where you think that something doesn't feel right, but let's wait. We don't have enough money, or we don't have insurance, or whatever. No, don't wait. Please don't wait. I don't blame myself for what happened to my mom. I could have easily done that, but I recognize that it's part of a culture where you think you have the cold and it's something simple and you're not sick. And with COVID, my cold symptoms and my flu symptoms, you'd hardly notice them, except that I get real tired. And so it's like, even that has changed. I don't know if it's because of the vaccines that made us stronger in some ways, but at the same time, to the point that we don't recognize that we're really sick. And we talked about that very briefly. And then our lifestyles. We're super busy. We work hard. We're trying to have healthy meals, but we don't have time to prepare them, so we're picking them up, and even then they're not well prepared. And then not even going into the types of recalls we're having in terms of the things that we're consuming and the things that are in our beverages that we drink, our milk, etc. All these complicate everything. But the important thing I want our community to know, and I think our doctors also, because we've consulted about this, and you also, is to recognize if you have a cold and you think it's a simple cold, please mask. Please pretend it's like COVID again, where, you know, distance yourself, clean the spaces, wash your hands, and all the other things that you did when you were afraid of COVID hitting your family, because we knew what it did to our community. It devastated us in many ways.
And I just want to convey to you how grateful I am for you reaching out. You are always welcome at this table. Don't need an invitation. You come when you want to, when you feel there's something to share. You're always welcome here.
Thank you.
Dr. Heydarian, any last words that we need to keep in mind?
Well, as Dr. Valles said, please wear mask. Please take care of yourself. And if you feel any symptoms of fever, cough, cold, congestion, runny nose, sneezing, please use the clinics, go to your provider, be tested, and try to take care of yourself by eating healthy, exercising, taking your supplement, I think those are the important thing, and usually it starts from October to March, April. So please be aware of that.
Thank you. Thank you for your work here in our community. Thank you for caring. Thank you for taking the time. You both have patients to see, but you know, this is valuable information. So thank you for your work. May you continue to be well.
Thank you.
Dr. Jazari, any last words, my friend? What do we need to keep in mind?
So an ounce of prevention is worth a pound of cure, right?
Yes,
and so if so anything that we can do to prevent really does help out. Don't, you know, if you're sick, don't panic, but being alert and being proactive early really is worthwhile. Just keep in mind, if you're pregnant in the fall between 32 and 36 weeks, go ahead and get that RSV vaccine, the Abrysvo. And then if you have a little one under the age of 8 months in the fall, also if your pediatrician recommends, then get the monoclonal antibody as well to help prevent. And just be caring about those around you, and that's all.
Yeah, no, thank you for coming and sharing and being accessible to us. I mean, that matters. The information matters. Your time matters. So thank you for that. So we'll wrap up here. Thank you on behalf of me and my guests today. We will have some information for you at the very end of the show. And thank you so much for tuning in again. We'll see you soon. Bye.